I have sent to the Congress today a series of proposals to help fight mental illness and mental retardation. These two afflictions have been long neglected. They occur more frequently, affect more people, require more prolonged treatment, cause more individual and family suffering than any other condition in American life.
Mental health in America has had a long and complicated history. For a very long time, the standard in mental health care was to institutionalize patients. However, as a result of the deinstitutionalization movement of the 1950s and 1960s, the Community Mental Health Centers Act of 1963 was passed. This promoted community-centered mental health care and the dismantling of dysfunctional mental hospitals. This also created a new frontier in how mental health would be treated. Focus shifted from intensive inpatient care to community-centered outpatient care. To understand the Community Mental Health Centers Act, the background of mental illness must first be explored. Prior to the 18th century, mental illness was thought to be a spiritual problem. These people were often incarcerated where they suffered abuse. However, due to the Enlightenment movement, a greater emphasis was placed on the physical causes. An idea called moral treatment became popular. This centered on the thought that mentally ill people may be cared for if they were treated with kindness and learned to think rationally. However, at the same time, hospitals such as the Pennsylvania Hospital still existed where people would be kept in chains and basement cells. Hospitals based on moral treatment were significantly better. However, only the upper class could afford them. Hospitals lower class patients were sent to were often overcrowded and understaffed. During the 1850s, activists such as Dorothea Dix started lobbying for change. By the 1870s, the construction of 32 state hospitals were being funded by the U.S. government. Asylums spread across America. However, only a portion of patients were kept there. The rest stayed in jail cells, where they were neglected and abused. World War II was a major catalyst in the development of the deinstitutionalization movement of the 50s and 60s. It had forced people to confront the reality of mental health care during the time. One of the ways it did this was through enlistment. According to General Lewis B. Hershey, director of the Selective Service System, mental illness was the greatest cause of non-effectiveness or loss of manpower that we met. From those who were enlisted as soldiers, 38% were discharged due to mental disabilities. Soldiers on alternative duty also contributed to the condemnation of mental hospitals. During World War II, 1/3 of those on alternative duty were assigned to mental hospitals. Their reports described the horrifying conditions of them. This opened the nation's eyes to the widespread problem of mental illness and the poor condition of mental hospitals. This paved the way for advocates such as Robert Felix to create significant change. Robert Felix was a major advocate for community treatment and was against state hospitals. He contributed to the creation of the National Institute of Mental Health, or the NIMH, and was the chief of the Mental Hygiene Division of the Public Health Service. Most notably, he created the plan that would allocate government funds in fighting mental illness. He, along with other advocates, were able to eventually put the plan into action. One major factor that contributed to this was the election of President Kennedy. His family had a complicated history with mental illness. His sister, Rosemary Kennedy, showed signs that she was on the spectrum of schizophrenia, schizoaffective disorder, and bipolar disorder with psychotic features. Her father, Joseph Kennedy, tried to keep her hidden for the majority of her life. She was sent to live in a convent in London where her father was an ambassador and assigned people to look after her. Joseph Kennedy eventually resorted to having Dr. Walter Freeman and Dr. James Watts perform a lobotomy on her. The lobotomy made her condition much worse, leaving her to lose her ability to speak and perform basic everyday tasks. This forced her to spend the rest of her days in St. Coletta's School for Exceptional Children, a convent in Jefferson, Wisconsin, where she could remain hidden from the public. While Rosemary Kennedy's father intended to hide her, other Kennedys did not feel the same way. The family still contributed funds towards mental health research through the Joseph P. Kennedy Jr. Foundation. By the time, John F. Kennedy also became president, and Eunice Kennedy Shriver, President Kennedy's sister, pushed the president to promote better mental health care. This was very encouraging to mental health advocates. By 1961, President Kennedy announced the President's Panel on Mental Retardation, and this was formed to make recommendations on issues regarding mental health. The Interagency Committee on Mental Health was also formed. They eventually adopted Robert Felix's plan to make community mental health care a reality. By this time, major developments in mental health care were also being made. A new drug discovered in 1952 called Thorazine greatly reduced delusions, hallucinations, and manic symptoms was discovered. The development of new drugs made community mental health care seem more realistic. With all these factors, the deinstitutionalization of the 50s and 60s were well on its way to produce the Community Mental Health Centers Act of 1963. On October 31st, 1963, President John F. Kennedy signed the Community Mental Health Centers Act. This was a revolutionary act meant to start the creation of community-centered mental health care. It is a 17-page document outlining the details of combating mental illness through grants. These grants would support the construction of research centers, facilities, and community centers dedicated to fighting mental illness. Anyone from nonprofit institutions to universities could apply for the grant. It also involved money for training teachers of mentally ill children. This act was the gateway for modern mental health care as we know it. In 1966, the first federally funded community mental health center opened. By 1967, 53 other health centers opened. In the following 13 years, a total of 789 centers would open. Even though the act did not directly mention hospitals, they would still be impacted by it. The number of patients decreased by 165,571 people between 1960 and 1969. This was because court cases about whether to send or keep people in hospitals were beginning to rule they wouldn't have to go if a less restrictive method was found, such as community mental health centers. This helped popularize the idea that people should only be admitted to hospitals if they were a danger to themselves or others. Also, with the creation of Medicaid and Medicare, hospitals were incentivized less to keep patients because those programs would not cover mental illness. With the creation of the Community Mental Health Centers Act, people would have an alternative place to go. Even though the number of people in hospitals were decreasing, a large portion of severely mentally ill people still remained in them. This was because many community mental health centers were still hesitant to treat them. As less and less people were admitted to mental hospitals, the more they started to close. Soon, community mental health centers became the predominant form of mental health care. This greatly reduced the mentally ill's exposure to abuse in mental hospitals. However, access to care provided by community mental health centers became very difficult to find. There was a lack of funding needed to properly deinstitutionalize, and therefore a lack of resources needed to care for those with mental illness. This resulted in transinstitutionalization, which is the institutionalization of people with mental illness in nursing homes, hospitals, and jails. An example of this is prisons in New York. Areas with physician shortages also have prison units with the highest number of people with mental health needs. There was also an increase of homelessness due to deinstitutionalization, because with the closing of mental hospitals, the mentally ill often had nowhere to go. Those with severe mental illness were also less likely to have family support. Those with family support put a greater stress on their family members. There is evidence of greater psychological and financial burdens on family members of the mentally ill. The Community Mental Health Centers Act of 1963 was an act that revolutionized how mental health would be treated in America. Before the act, the people who suffered from mental illness would be institutionalized in hospitals where they suffered abuse. However, the Community Mental Health Centers Act allowed for the creation of community mental health centers, which would eventually overtake hospitals. The creation of these centers phased out the use of mental hospitals by decreasing the number of patients in them. This led for community-centered mental health care to be the primary type of mental health care. It is important to note that this act was supposed to improve the condition of mental health care pre-1960s. The act did significantly change the type of care offered, but it did not necessarily better the situation for sufferers of mental illness. They are no longer exposed to the abuse that occurred in these hospitals, but the likelihood of homelessness and incarceration increased for them. The historical significance of the Community Mental Health Centers Act is that it shaped the way modern mental illnesses are treated. We can learn a lot about the root causes for the faults in current mental health care systems by studying this act. By finding the root causes for the problem, hopefully one day we can solve them and provide better mental health care for all.